Hi, I hope you all are doing good. Well, today the most popular, I would say, the question for CKD folks is about which vegetables to eat. There have been endless debates on whether CKD patients should stop eating vegetables or they overcooked vegetables or leached vegetables, or whether they use only some fixed vegetables, or whether they make vegetables into a smooth paste by adding too much of water, cooking, and then making a colorless, odorless recipe of vegetable. Well, these are all very, very wrong notions about the vegetables a CKD should eat. One must remember that in CKD, when we talk of low protein diet or moderate protein diet, we should also know that the best food in CKD, beyond protein, carbs, and fats, is the fiber content of the food. Higher the fiber content in your food, better will be your system, better will be your gut health, and so also you will be able to absorb and digest food, apart from the long list of medicines that most of you take every single day. So, what do we do to make the right choices of vegetables? Now, to remember, there is one important list. These are picked because of their either potassium content or phosphorus levels or uric acids being high because of these vegetables. The most popular being the red tomatoes, spinach or palak, then the brinjals, which are stopped by many, knowing that the seed of it is not safe. As per Ayurveda, also they recommend not to eat brinjals, so brinjals are out. But I am okay with brinjals once in 15 days. In the green brinjals are still better than the purple ones. Then there is a list of drumsticks, moringa leaves, and also to some extent the Karela and lady's finger. Karela is your bitter gourd, and lady's finger or your bhindi. These are the vegetables which are high on potassium, and some are high on uric acid. Like red tomatoes are definitely a no for those who have high uric acids, and spinach is also high on uric acid. So these are peculiar vegetables which you need to avoid. As in, you are not going to use them as a regular food in your everyday cooking. So that is what you have to remember. So because any vegetable for that matter is very delicate in terms of its nutrition, it is only good in terms of fiber content and antioxidants, so there is no bad vegetable as such. But however, given the background that you need to stipulate your potassium intake, phosphorus intake, urea, uric acid, all this comes into picture, we need to be extra careful in picking and choosing those specific vegetables. Now, while these are one set of vegetables which we are not going to eat on a regular basis, there is a large set of vegetables which are absolutely safe, which can be used in a normal way of cooking that you do at home. You don't have to pressure cook these vegetables, you don't have to boil these vegetables. You just chop them, wash it clean, rinse, chop, and season, and give it a on a low flame, give a steam, and cook them with little of water, and they are done. They are all the gourds. So you have your bottle gourd, bitter gourd, bottle gourd, ridge gourd, and your ivy gourd. Then all your kinds of cucumbers that you get, the yellow cucumber as well as the green cucumber, all are good to make your vegetables. Apart from this, a ridge gourd is one good vegetable which can be also added as a part of your chutneys in place of replacing the red tomatoes. Just saute the ridge gourd to some time for like 2-3 minutes. Once the color little changes, then you can just add these, ground this into a chutney form with all the other spices that you typically use for green tomato chutney. The same can be repeated, replacing it with ridge gourd, which is a more better, safer option because it is very high in terms of fiber, and also it's a good source of iron too. So you can always use this as an alternative. So this is about the gourd vegetables. Then you have all the beans family. Remember that the protein coming from these beans is very minimal. Do not panic while eating your beans, French beans, cluster beans, string beans. All beans are safe, healthy, and actually improve the insulin sensitivity, which are very good. If you are a diabetic nephropathy patient, definitely you should have beans. Do not worry about the sodium, potassium, phosphorus levels in these vegetables. What you have to do is, whenever you use beans, chop them off, keep it aside, boil water. Once the water is boiling, bring it off the fire. In this hot water, leave the vegetable for just 5 to 10 minutes, drain the water, season the vegetable, and cook it. So this is the safest, and it retains all its fiber and digestible fiber, so which is very good option. So this is about the set of vegetables. We talked about the gourds and the beans family. There is another big set of vegetables, that is the capsicum family. Bell peppers, I am sure most of you would have read all over the internet that capsicum is one of the best foods for CKD. So they eat it every single day, most of them who do Google. So red bell peppers, yellow bell peppers, green capsicums, all are good. Apart from these, you can also use to some amount your regular cauliflower and cabbage if you are not having thyroid issues. But having said that, it is not recommended for patients with thyroid problems, hypothyroid especially. But then you can always eat it in small portions in cooked form. There is nothing wrong if you are eating a cabbage or a cauliflower in cooked form as a curry in one of the meals in the entire week. It is not going to harm you so much, unless it affects to an extent that you are eating raw cabbage every single day as part of your salad for a good 2 3 weeks. Maybe then you would find some goitrogenic changes, and you would have some issues with your thyroid. It might affect. But cooked form of cruciferous vegetables, that is your cabbage, cauliflower, and the broccoli, are all fine as long as you are eating it in cooked form or blanched form. Okay, so these are the list of vegetables which you can eat without guilt, without fear, and in the normal way. Only remember, your vegetable cooking should not be on a high flame. Always cook it on a low flame with little of oils and lot of nice flavoring with your little of coriander, mint, fresh mint, or basil, whatever is available, and make it flavorful. And do not add too much of spice or red chili powder, green chili powder, garam masala. Then it adds up on your water intake again. So ensure that you are making this as a very simple sattvic kind of a vegetable which looks colorful, tempting, and healthy. So all this should be the key ingredients of your vegetable. I hope this helps most of you to eat vegetables without fear, and add more fiber